A class action lawsuit has been filed against Tiger Brands. That's over the death of at least 183 people from Listeria. Earlier this month, Enterprise was forced to recall a range of cold meat products after Listeria was found at its factory. Now, the National Institute for Communicable Diseases has played a pivotal role in identifying the source of the Listeriosis outbreak. As part of its Listeria surveillance program, the Institute plans to do more testing of food and food production environments. Dr. Juno Thomas from the Institute joins us now. Good evening, Doc. Thanks very much for coming through. First, perhaps your thoughts, if any, on the lawsuit that was filed last night against Tiger Brands?
So I really can't comment on the contents of the lawsuit. I mean, the laboratory data that we generate at the NICD and the epidemiological data is kept confidential and shared only with departments of health.
Now, what is the Institute's position? Let's say if you were to be asked by either the applicants or the court to assist during the course of the proceedings, what will be your attitude towards that, or what is your official standpoint with regard to?
So there certainly are standard legal procedures for obtaining laboratory records in medico-legal cases, and that would have to be followed as usual practice. So they would have to engage with the legal entities at departments of health as well as within the NHLS and the NICD.
Remind us again, let's take now a few steps. I can go back to when it was, how you got to know that this was listeriosis before you could even get to, you know, the source.
So it started in July of 2017, where a group of doctors at Chris Hani Baragwanath Academic Hospital noticed that more cases of listeriosis were being diagnosed in newborns in the hospital than was usual. And in fact, it was quite remarkably an increased number of cases. And they reported this to the NICD and asked, if there'd been other similar reports of increased cases. Pathologists and doctors at Steve Biko Academic Hospital also noticed an increase in cases, predominantly in their newborns as well. And this prompted the NICD to do a retrospective review and see how many cases had been diagnosed by laboratories in South Africa, not only in the public sector, but also in the private sector for the year. And we compared it to the number of cases that had been diagnosed in the 4 years before, and noticed that certainly in June and July there were more cases than usual. And this trend kept on creeping up, and unfortunately listeriosis wasn't a notifiable disease before the 15th of December 2016.
That has all changed now.
It's all changed now. But, with the increasing trend in cases, obviously we were very concerned, alerted healthcare workers to be on the lookout, and started to try and get data more real time to report on the increasing trends. And then, as you know, the rest is history. It was reported to national departments of health. The minister took the matter extremely seriously and was very proactive, first announcing it on the 5th of December formally to the country that we were dealing with a serious public health outbreak.
And then you had to now find the source. How did you go about doing that part? So
one thing about history is you can always look back at other people's mistakes and other people's victories, and it guides you. And the first big outbreak where they prove that food was the source of contamination that led to disease was in Canada in the 1980s, where they traced people who had developed listeriosis and asked them what they'd eaten, and went to their homes and sampled food that was in their homes. And that way they were able to tell that most people had eaten coleslaw, or shredded cabbage is what we would call it. And in fact, they sampled shredded cabbage from people's homes, and they grew the same strain of Listeria. So that's exactly what's been done in many listeriosis outbreaks since. And it's exactly what we did. We interviewed patients who developed disease to find out what foods they'd eaten in the months before falling ill, to see if there was any pattern emerging. And we also then informed departments of health as soon as we knew about new cases. Environmental health practitioners then went to people's homes and sampled any food that may be there in their fridge or freezer, and these were sent for testing. And this was ongoing for many months until we had the breakthrough on the 12th of January this year.
Did you notify Tiger Brands?
Did we notify Tiger Brands of
that, for example, that their products contained, was or could have been responsible for listeriosis?
So, I mean, what was happening all along is that this sampling had been ongoing since at least November, you know, where patients were being visited and sampling was taking place from their homes. And whenever we found Listeria, a traceback was initiated. So once we had found Listeria in a food item from the patient, they then traced back where that food item was bought and where it was produced, and then those retailers and factories were all visited. And that's exactly what happened in December with the Sovereign Foods abattoir debacle. It was related to a sample of chicken found in a patient's freezer that tested positive. We went back to the retailer, and then Department of Health went back to the abattoir, and it was traced all the way back. And it's exactly the same process that happened with the polony that led us to Enterprise Foods.
Well, the only reason I'm asking this was, curiously, when the CEO of Tiger Brands addressed a media briefing, one only briefing that they had, he said, oh, well, we'd hope that if only the minister could have told us first, you know, before going public on this. I'm like, but how does this work? Would the center not have contacted, you know, the company and said, hey guys, please look at your products because this is what we have found? Is that not how it works?
So we had found Listeria in multiple products that were at the creche that was the epicenter of the clue to our investigation. And we had to investigate all those different types of products. And that's what led us to the Enterprise factory. And certainly the Enterprise factory was visited on the 2nd of February, which is a month before the minister made his announcement. So, you know, the Enterprise were well aware that we'd visited, that we'd sampled very extensively throughout the environment, that we had, you know, observed and commented on some, you know, potential safety issues with regards to Listeria in the production environment. So they were aware that we were looking for Listeria, and that we were concerned that Listeria may be an issue in the type of product they're producing. Just as it was, you know, that we went to visit the RCL production facility in Wolverhoek, again, because it's a large ready-to-eat processed meat facility. And this is the perfect type of food that leads to such large outbreaks with listeriosis.
The one big lesson we've learned from this episode?
I think the big lesson is that we all need to take food safety more seriously across the board, from the community and their knowledge about how to keep themselves safe at home every day, principles to follow for food hygiene, from healthcare workers to make them aware of how important it is to notice potential outbreaks of foodborne disease and to report them, and then of course to, you know, the food industry itself, and, you know, at a government level in terms of you know, addressing gaps and challenges in the current legislation to improve food safety monitoring and governance going forward.
Dr. Thomas, thanks very much for coming through this evening.
Thank you.